Jennifer was a financial planner. That detail matters. She wasn't irresponsible. She wasn't financially illiterate. She literally helped other people manage their money for a living. She had a 6-month emergency fund, a fully maxed 401k, no debt, a paid-off car, employer health insurance with a solid-looking plan, $150 per month in premiums, $2,000 deductible, $8,000 out-of-pocket maximum. She did the math. Worst case, $8,000 in a year. She could handle that. Then she found a lump. Stage 2 breast cancer. Caught early? Good. Treatable? Good. Covered by insurance? Theoretically. 18 months later, Jennifer had paid $37,000. Not her insurance company. Jennifer. Here's the breakdown. $8,000 in year 1. $8,000 in year 2, because treatment crossed January 1st, the calendar reset nobody warns you about. $14,000 in denied claims her oncologist ordered, but her insurer called not medically necessary. $7,000 in out-of-network anesthesia from a doctor she never chose, never met, and couldn't refuse because she was unconscious. By month 4, her emergency fund was gone. By month 6, she stopped contributing to her 401k. By month 12, she had $11,000 on credit cards. By month 14, she raided her retirement account, triggering taxes and penalties on money she'd spent decades building. Jennifer survived the cancer. She did not survive it financially. At 53, she's starting over. 20 years of discipline erased in 18 months. She did everything right. It didn't matter. This is the American healthcare trap. You can do everything right and still get destroyed. Americans are sold a comforting story. If you have health insurance, you're protected. You pay your premiums, meet your deductible, hit your out-of-pocket max, and insurance pays the rest. That's the deal. That's why you pay $500 a month. That's why you choose the plan with the $7,000 maximum instead of the $12,000 one. It feels responsible. It feels rational. It feels safe. The math is a lie. Here's the data that should make your stomach drop. According to a 2019 study in the American Journal of Public Health, 66.5% of all personal bankruptcies in the United States are tied to medical issues. 2/3. But here's the part that breaks the narrative. 72% of those people had health insurance when they got sick. They weren't uninsured. They weren't reckless. They paid their premiums, and they still went bankrupt. Health insurance in America doesn't protect you. It gives you access to a financial machine that extracts from you more efficiently. Every plan has an out-of-pocket maximum. What most people don't realize, it resets every January 1st. Get cancer in October, start treatment in November, and by February, you're paying your max twice. $16,000 for what feels like one illness. Chronic condition, you pay that max every single year. 10 years equals $80,000. 20 years equals $160,000. That's not a ceiling, that's a toll booth with no exit. Insurance companies deny claims constantly. According to Kaiser Family Foundation, the average denial rate for in-network claims was 17%. Some insurers exceeded 30%. Here's the sinister part. Fewer than 1% of denied claims are ever appealed. Why? Because patients are sick, tired, scared, buried in paperwork, and the insurance companies are counting on that. Every unappealed denial is pure profit. This isn't ethics malfunctioning. This is capitalism behaving rationally. If your profit formula is premiums minus claims paid equals margin, then denying claims isn't an exception. It's the business model. In America, choosing your doctor doesn't mean choosing your care team. The anesthesiologist, out of network. The radiologist, out of network. The lab processing your blood, out of network. You never consented to them. You never met them. You couldn't refuse them even if you tried. And out-of-network charges often don't count toward your out-of-pocket maximum. This is not a bug. This is a feature. Fragment the billing, fragment the cost, fragment the liability, and the burden falls on the patient.
Let's talk numbers.
According to Kaiser's 2023 survey, the average family premium for employer-sponsored insurance is over $23,000 per year. Employers pay approximately $17,000. Employees pay approximately $6,000, about $500 per month. And that's just the premium. That's what you pay to be healthy. If you get sick, the real cost begins. Premiums, deductibles, co-pays, co-insurance, out-of-pocket max, denied claims, out-of-network charges, prior authorizations, ambulance fees, calendar resets. Suddenly, Jennifer's $37,000 nightmare isn't unusual. It's typical. The American middle class builds security on 3 pillars. 1. Retirement accounts, 401k/IRA. 2. Home equity. 3. Emergency funds. These are rational strategies until biology intervenes. A diagnosis can erase 20 years of compounding. A surgery can liquidate your home equity. A few billing cycles can vaporize your safety net. This is not financial failure. This is system design. Healthcare in America treats illness as an extraction event. The extraction happens at your most vulnerable moment, when you have the least bargaining power and the least energy to fight. Medical care in America has been financialized. It's no longer just healthcare. It's a credit system. Treatment becomes bills. Bills become debt. Debt becomes collections. Collections become interest. Interest becomes bankruptcy. According to the Census Bureau, 23 million American adults owe medical debt. Over $88 billion in collections. And that's only what made it to collections. It doesn't count the debt on credit cards, the retirement withdrawals, the refinanced homes. Health insurance does not sell protection. It sells the illusion of protection. You're not buying safety. You're buying access to a system that profits by denying you when you need it most. In casinos, the house always wins. In American healthcare, the house is the insurance carrier. Everyone else is a player who didn't know they were sitting at the table. Jennifer beat cancer, but she didn't beat the system. And neither will you, unless the system itself changes. If this opened your eyes, share it. The system counts on your silence.